Periodontal Case History Recording Part 2, Periodontal Examination. This section contains 3 components: recording of probing pocket depth, recording of clinical attachment level, and recording of mobility. Clinically, these parameters were very important to differentiate between gingivitis and periodontitis. First, let's see how to record probing pocket depth. Consider the tooth and the gingiva. In gingiva, it is important for you to know 2 landmarks: the margin of the gingiva and base of the pocket. The distance from marginal gingiva to the base of the pocket is recorded as the probing pocket depth. Margin of the gingiva can be identified by visual examination, whereas the base of the pocket is identified by using periodontal probe. The periodontal probe is a calibrated instrument with each marking corresponding to 1 mm. To record PPD, insert the probe passively parallel to long axis of the tooth till you feel the resistance and stop. The marking of the probe against the margin will give you the value of probing pocket depth. In this case, the 4th marking is against the margin and hence the PPD is 4 mm. In this example, when you insert the probe, the 5th marking lies against the margin and the PPD is 5 mm. Let's see another example. Here, when the probe is inserted, the 3rd marking lies against the margin of the gingiva and hence the PPD is recorded as 3 mm. Now moving to recording of clinical attachment level. Clinical attachment level is measured as the distance from the cemento-enamel junction to the base of the pocket. You would have already measured the distance from the margin to the base of the pocket, which is the probing pocket depth. To calculate CAL, you will now have to measure the distance between CEJ to margin. Hence, we need 2 measurements: the probing pocket depth and the distance from cemento-enamel junction to margin to calculate CAL. It differs in 4 scenarios according to position of the marginal gingiva. The first, when the marginal gingiva is 1 mm above CEJ and the base of the sulcus is at the level of CEJ, which is normal. The next scenario, when the marginal gingiva is at the level of CEJ and the base of pocket is apical to CEJ. Thirdly, when the marginal gingiva is apical to CEJ as in case of recessions, and finally, when the marginal gingiva is coronal to CEJ as seen in enlargements. Now let's see how to measure CAL if marginal gingiva is apical to CEJ, that is in case of recession. We already know we need 2 measurements to calculate CAL. One is the probing pocket depth and second is the distance from cemento-enamel junction to the margin. In this case, CAL is calculated by adding both the values. CAL is the sum of probing pocket depth and the distance from CEJ to the margin. Take this example. Measure the probing pocket depth. Here the 4th marking lies against margin, hence the PPD is 4 mm. Now measure the distance from CEJ to margin. Here it is 3 mm. So CAL will be 4 mm plus 3 mm, 7 mm. One important note: in case of recessions, the value of CAL will be greater than the value of PPD. If marginal gingiva is coronal to CEJ as seen in case of enlargements, let's see how to calculate CAL. CAL will be obtained by subtracting the 2 values. CAL is the difference of PPD and the distance from CEJ to the margin. Take this example. Insert the probe and measure the pocket depth. Here it is 5 mm. Then measure the distance from CEJ to the margin. In this case, CEJ will not be visible. Hence, it has to be identified with tactile sense. Run the probe from crown towards the root and you will feel a small dip or a catch. This point will be the CEJ. You will be able to do it with practice. In this case, the distance from CEJ to margin is 3 mm. So, CAL will be 5 mm minus 3 mm, 2 mm. In case of enlargements, the value of CAL will always be lesser than that of the probing pocket depth. Moving on to the 3rd scenario, if the CEJ is at the level of gingival margin. When the marginal gingiva is at the level of CEJ, CAL will be equal to PPD. Let's see how. When measuring the pocket depth, the 5th mm lies against the margin and hence PPD is 5 mm. Now the distance from CEJ to margin, since the marginal gingiva is at the level of CEJ, the value will be 0. Hence, if you either add or subtract, the value is going to be the same. So, when the marginal gingiva is at the level of CEJ and the base of the pocket is apical to CEJ, the value of CAL will be equal to that of the PPD. Now looking looking at the normal scenario where the marginal gingiva is 1 mm above CEJ and the base of the sulcus should be at the level of CEJ. CAL will be again PPD minus CEJ to the margin distance, because the margin is still above CEJ or coronal to CEJ. So here the value of PPD is 2 mm. Since the base of the sulcus is at the level of CEJ, the distance from CEJ to the margin is also 2 mm. So when you subtract both the values is 0. Hence, under normal condition, the clinical attachment level will be 0. So keep in mind, the CAL value calculation depends on the position of the gingival margin. If it is apical to CEJ, then you have to add both the values. If it is coronal to CEJ, as in case of enlargements, you have to subtract both the values. When the CEJ and marginal gingiva is at the same level, but the base of the pocket is apical to CEJ, then CAL will be equal to PPD. If the marginal gingiva is 1 mm above CEJ and attachment or the base of the sulcus is at the level of CEJ, your CAL will be 0. So under normal conditions, CAL will be 0. Let us assume this is the periodontal recording of the patient. If done right, this chart will give a fair idea about the periodontal status. Let's see how. In this chart, if PPD is greater than 3 mm, we can infer that there are pockets in those teeth and those teeth have periodontitis. See, for example, all these teeth have probing pocket depth greater than 3 mm. So all these teeth have periodontal pockets. Secondly, all these teeth where CAL is indicated by yellow circles, you can see that the value of CAL is greater than the value of the PPD, which means all these teeth have recession. The margin of the gingiva is apical to CEJ. In this chart where the values are indicated by blue circles, all the value of CAL is lesser than that of the PPD, which means in all these teeth, the marginal gingiva is coronal to CEJ, indicative of gingival enlargements. In these conditions where the value of CAL is equal to PPD, this means that the marginal gingiva is at the level of CEJ, but the base of the pocket is apical to CEJ. Finally, in all these teeth where the value of CAL is 0, it means that the teeth is normal. It does not have any attachment loss. Now, moving on to the next section of the chart called as mucogingival problem. Here, as an undergraduate student, you are supposed to write the class of recession. So, whichever tooth presents with recession, write whether it belongs to Miller's class 1, 2, 3 or 4. Here, all the teeth indicated by yellow circles have recession and you mention the class of recession. For example, here the 1 has class 2 recession, whereas rest all teeth have class 1 recession. Looking at mobility, mobility is graded from 1 to 3 and based on the findings, record the grade of mobility here. According to this chart, the teeth 2-2 and 4-1 have grade 2 mobility, whereas the teeth 4-2 and 3-1 has grade 1 mobility. So this will complete the periodontal findings section of the case history. Thank you.